You're rooming a patient. You've just taken their blood pressure. And as you're wrapping up the cuff, they look at you, their eyes filled with pure, unfiltered fear. They point to a dark, jagged mole on their arm and ask the question that makes every healthcare professional's heart stop for a second. Does this look like cancer to you? Be honest. Every single ounce of your humanity, every fiber of your being as a caregiver, wants to comfort them. You want to ease that anxiety. You want to look at it, offer a reassuring smile, and say, honestly, it just looks like a normal freckle. I'm sure it's nothing. If you say those words, you didn't just comfort a patient. Legally, you just diagnosed them. And if you are a medical assistant, a tech, or a student, you just stepped over a line. A critical, non-negotiable line. You just violated your scope of practice and put your entire career on the chopping block. Welcome back to MAP, Medical Pathways for Success. I'm your host, Fred Nazario Alvarado. Today, we're talking about the hardest discipline in healthcare. The discipline of knowing your boundaries. We are defining the exact line where your job ends and the provider's job begins. But this isn't just a boring legal lecture. This is a survival guide. Because we're also going to dismantle the one most dangerous piece of advice you will ever hear in your career. And that's the phrase, stay in your lane. We're going to talk about why knowing your scope of practice makes you a patient advocate, while blindly staying in your lane can make you a bystander. This is about integrity, courage, and professionalism. Let's get into it. Let me tell you why people violate their scope of practice. It's almost never because they're arrogant or trying to be reckless. It's usually for one of two reasons. Two powerful internal forces that I call the empathy trap and the ego trap. Let's start with the first one, because it comes from the best part of who we are, the empathy trap. We get into this field because we are fixers. We're helpers. We can't stand to see people in pain or distress. So when a patient is in front of you, anxious and scared, your immediate, hardwired instinct is to make it better. Imagine a patient is crying because they're terrified about what their lab results might show. Your heart goes out to them. The empathetic part of your brain screams, just tell them it's going to be okay. Reassure them. But here's the hard lesson. In healthcare, your greatest strength, your compassion, can become your biggest liability if it's not guided by professional discipline. Empathy without boundaries is dangerous. When you give into that urge to offer false reassurance, you might be doing more harm than good. You might be giving them a moment of comfort at the cost of the urgency. You might be inadvertently convincing them that their very real concern is probably nothing. causing them to delay follow-up. You're trying to treat their anxiety, but you're not qualified to diagnose its source. That's the trap. But there is a second trap. It's not just empathy. Sometimes, it's the ego. And this one is a little harder to admit. The ego trap isn't always about arrogance. It's often born from experience. You've been on the job for a few years. You've seen 100 cases of strep throat. You know what it looks like, what it smells like. So when the 101st patient comes in with the exact same symptoms, a voice in your head says, I know what that is. The doctor's just going to confirm what I already know. I can save this patient some worry and just tell them. That voice comes from a good place. A desire to be competent, to be efficient, to be seen as a valuable member of the team. But that voice is your ego talking. And it's tempting you to cross the line from data collection into interpretation. And this second trap, the ego trap, is something I had to face head on. I learned this lesson the hard way when I transitioned from the military to civilian world. As a Navy corpsman, my scope of practice was incredibly broad. If you were willing to learn and your providers trusted you, they would teach you anything. I've intubated patients. I've learned how to do nerve blocks, even spinals. Out in the field with the Marines, I was the one they counted on to handle the traumas, to push meds, to operate with a high degree of independence because lives depended on it. Corpsmen are never just medics. Don't call a corpsman a medic. You will get an earful. We are doc. That's what they call us. It was a title of trust. Then I came home. I separated from the Navy. And when I got back into civilian healthcare, I was suddenly told, you aren't allowed to do that here. And let me tell you, that is a massive ego hit. It's profoundly frustrating to stand in a room knowing you have the skills to perform a procedure that could help someone, but being told that a piece of paper, a civilian license, says you can't. My hands knew what to do, but the law told me no. It took me a while to process that. But what I eventually understood is that the scope of practice isn't about what you are capable of doing. It's strictly and only about what your current license legally protects you to do. If you don't check your ego at the door, your pride will cost you your license. Stepping outside of your legal scope doesn't make you a hero. It makes you a liability. And it's a lesson I had to learn by swallowing my own pride and respecting the new set of rules I had to play by. Now, this brings me to the absolute core of today's episode. We need to draw a hard, bright line in the sand between two ideas that sound similar but are worlds apart. Scope of practice and stay in your lane. Scope of practice is a legal and ethical framework. It's defined by your state's professional regulations. It's a non-negotiable standard of care designed to protect the public. It ensures that everyone on the team is qualified and credentialed for the task they perform. It's the foundation of patient safety and professional integrity. Stay in your lane, on the other hand, is workplace jargon. And let's be brutally honest about where that phrase usually comes from. It's not born from a desire for patient safety. It's born from fear and hierarchy. It's a tool often used by insecure leaders or stressed out colleagues to shut down questions and protect their own ego. It's a passive-aggressive way of saying, don't challenge me. Don't make more work for me. Or your input isn't welcome here. Without having to defend a bad decision. It creates a culture of silence where people are afraid to speak up, even when they see something wrong. Let's use a metaphor. Imagine healthcare is a highway system. We're all driving towards the same destination, a positive patient outcome. The person who believes in stay in their lane just stares straight ahead. Their focus is narrow, limited only to the piece of asphalt directly in front of them. They see a problem in the lane next to them, a car swerving, smoke coming from an engine, a driver who looks distressed. And they think to themselves, not my problem, not my lane. They just keep driving, leaving the potential disaster for someone else to handle. Now, contrast that with a true professional. A professional who understands that their primary job is to operate their own vehicle safely. That's their scope of practice. They know their car's capabilities. They follow the traffic laws. And they perform their specific function flawlessly. But their head is on a swivel. They are constantly practicing situational awareness. They see that swerving car and they don't ignore it. They recognize it as a threat to the entire system. They might slow down, create space, or even honk to get the other driver's attention. They are aware of the whole team. When an accident happens right next to them, the stay in your lane person just drives past the wreckage. The professional pulls over. They call for help. They render aid within their scope. They don't perform surgery on the side of the road. That's not their scope. But they might apply pressure to a wound, direct traffic, or comfort the victim. They do what they are trained and legally allowed to do to help the team. That's the difference. Knowing your scope of practice isn't a cage that limits you. It's your foundation. It's the solid ground you stand on that gives you the authority and the confidence to speak up. I have heard countless stories, and I'm sure you have too, of a medical assistant who notices a subtle symptom the doctor missed and spoke up, preventing a misdiagnosis. Or a tech who saw a medication order that seemed dangerously high and flagged it, preventing a serious medical error. Were they staying in their lane? Absolutely not. They were practicing at the highest level of their profession. They could speak with the authority because they were flawlessly executing their own scope. taking vitals, reviewing orders, listening to the patient. And then they noticed something that didn't add up. They weren't trying to be the doctor. They were being an expert MA. They were being a protector. This isn't just about life or death moments either. It could be you noticing that the new check-in process is causing patient data to be entered incorrectly. The stay-in-your-lane person grumbles about it in the break room. The professional goes to their manager with data and says, I have noticed a pattern that's creating risk. Can we talk about a solution? One philosophy builds teams. The other builds silos. One is about collective responsibility. The other is about individual blame. It's the absolute opposite of the military mindset I was trained in. One team, one fight. So let's be crystal clear. Your professional duty is to know and respect your scope of practice. Your duty is not to blindly stay in your lane. So, where is that line? Where exactly does that MA or tech or nurse role end and the providers begin? I'm going to give you a cheat code that you can use for the rest of your career. It's the most critical distinction you will ever learn. And it comes down to two words: data and interpretation. Let's break these down, because understanding this is everything. First, data collection. As a medical assistant, a tech, a student, a nurse, your primary mission is to be a world-class lead investigator. I want you to think of yourself as showing up to the clinic scene. Your job is not to solve the case right away. Your job is to gather the facts, the clues, perfectly, without bias or judgment. Taking vitals? That's gathering data. Running an EKG? That's gathering data. Drawing blood, taking a patient history, swabbing a throat. Data, data, data. And it's not just about checking boxes. It's about the quality of the data. It's the difference between writing, patient has chest pain, and documenting, patient reports a sharp, stabbing pain in the left side of his chest. Rated 8 out of 10? That started 20 minutes ago after walking up a flight of stairs. Do you see the difference there? One is a vague clue. The other is a high-definition piece of evidence. Your job is to provide that high-definition evidence. Now, let's talk about interpretation. This is the exclusive role of the provider, the doctor, the PA, the nurse practitioner. Interpretation is the process of taking all the data points, the vitals you collected, the patient history, the lab results, the EKG strips, and putting them together to form a clinical picture. It's looking at that puzzle you've assembled and saying, this is an arrhythmia, or this is an infection, or this mole is benign. This is their role because they have the advanced training, the understanding of differential diagnosis, and most importantly, the legal responsibility for the outcome. They are the ones who have to weigh the evidence and solve the case. This distinction is so critical that it's one of the first things I drill into my students. To make it stick, I walk them through a scenario that happens in clinics every single day. Imagine a 20-year-old patient walks in. He's fit, looks healthy, but he's complaining of chest pain. The MA rooms him, and the ego trap we talked about earlier starts whispering in their ear. He's young. He's probably just anxious or pulled a muscle at the gym. This is nothing. If the MA gives into that interpretation, what happens to their data collection? It gets sloppy. They might rush through the history. They might not ask clarifying questions. They document chest pain and move on. But the professional, the MA who understands their role, ignores that voice. They are a data collector. They take the vitals and note the patient's heart rate is a little high, maybe 110. They ask, when did the pain start? What does it feel like? Does anything make it better or worse? The patient says, it gets worse when I take a deep breath, and I felt a little winded walking in from the parking lot. The professional MA documents every single one of those facts, clearly and without bias. They report that data to the provider. The provider sees chest pain, tachycardia, pain with deep inspiration, and shortness of breath on exertion. And their brain immediately thinks of a life-threatening possibility the MA might not have even considered. A pulmonary embolism. Do you see the power in that? The MA didn't diagnose anything, but by doing their job, data collection, perfectly, they handed the provider the exact clues needed to save that patient's life. They didn't need to be the hero who solved the case. They were the hero who gathered the evidence that made solving it possible. Let me give you one more quick, everyday example. A patient asks you, can I take Tylenol with this new prescription? You might know the answer. You might have heard the doctor say yes to that exact question 100 times. But if you say yes, you can. You just prescribed medical advice. You just interpreted their question and provided a clinical directive. What if that specific patient has liver failure that you didn't see in their chart? What if they go into liver toxicity because of the Tylenol you verbally authorized? The doctor isn't going down for that. The hospital isn't going down for that. You are. Think of it this way. The provider is Sherlock Holmes. They are the brilliant detective who solves the complex mystery. But your job is to be Dr. Watson. You are the indispensable partner who gathers clues, documents the facts, and presents the evidence so clearly and accurately that Sherlock can make a life-saving deduction. You aren't just a sidekick. You are the foundation of the entire investigation. Now we have to talk about the dirty secret of scope of practice. Because in my experience, the biggest challenge to your professional integrity usually isn't the patient who is asking an innocent question. The biggest challenge often comes from your own team, from your own boss. I call this friendly fire. Picture this, because it will happen. It's 4:30 p.m. on a Friday. The clinic is slammed, the waiting room is overflowing, and your provider is running an hour behind. They look exhausted, stressed, and overwhelmed. They see you. They're trusted, competent MA. And in a moment of desperation, they see a shortcut. They rush over and say, "Hey, can you just authorize that refill for lisinopril for me? I'm drowning back here. Just hit approve." Or maybe it's, "Hey, I just got Mrs. Jones's labs result back. She has iron deficiency anemia. Can you call her and tell her she needs to start taking an iron supplement? I'm just drowning back here." Let's be honest about what that feels like in the moment. Your heart sinks a little. There's this immense pressure to be helpful, to be the one who eases the burden. The last thing you want is to be seen as difficult or not a team player. Your instinct is to say, "Of course, I'll take care of it." It feels like the right thing to do for your team. But this is the moment when your professionalism is truly tested. Because you have to remember the most important rule of friendly fire. Listen to me very carefully. A provider's stress does not expand your scope of practice. Their trust in you is a compliment, but it does not change the law. Their desperation does not give you a license to practice medicine. If you call that patient and deliver a diagnosis and prescribe a treatment, even an over-the-counter one, you are practicing medicine without a license. Period. And if something goes wrong, if the patient has a bad reaction to the supplement, or if they have more questions that you aren't qualified to answer, that provider, who was your best friend 5 minutes ago, is going to sit in front of a medical board and say, "I never told my MA to diagnose and prescribe. I just asked them to make a call." The shortcut you took to help them will end your career, not theirs. So, how do you handle this without creating conflict? You have to reframe what's happening. You are not saying no to your provider. You are protecting your provider. You are the guardian of the process. You are the last line of defense that protects them from making a mistake in a moment of stress. You are the guardrail on the edge of the cliff, preventing the whole team from going over. This isn't insubordination. It's the highest form of teamwork. So, you don't say no. You use what I call verbal Aikido. Aikido is a martial art about redirecting an opponent's energy, not meeting it with force. You're not blocking them. You're guiding them back to the safe path. Here are the scripts. Memorize them, practice them. If they ask you to authorize a refill, you say with a calm, helpful tone, "Absolutely. I've already got the refill prepped and ready on your screen. I just need you to click authorize when you have a second." Now for a more complex scenario. If they ask you to call a patient with a new diagnosis and treatment plan, you say, "Okay, I see the low hemoglobin here in the results. Since that's a new diagnosis, and she'll need specific instructions for the iron, that call really needs to come from you. Do you want me to get her on the phone for you right now so you can explain it to her?" See what you did there? You showed you were competent. You looked at the data. You respectfully reinforced the professional boundary. The call needs to come from you. And most importantly, you offered an immediate, helpful solution that makes it easy for the provider to do the right thing. You didn't create a problem. You solved one. You are not a roadblock. You are a professional who ensures the correct process is followed every single time. That level of integrity, especially under pressure, is what makes you an indispensable member of the team. It's what proves you can be trusted when it matters most. So we know how to handle friendly fire from our team. But now let's talk about the most common challenge you'll face: the patients themselves. First, let's get into their mindset. When a patient pushes you for an answer you can't give, they are not trying to be difficult. They're just scared. They're in a vulnerable position. And you are the person in the room with them, wearing scrubs, looking like an authority. They are looking for any piece of information, any shred of reassurance they can hold on to. Your job is to manage their anxiety without stepping over your professional line. This is where you need a specific skill. For those of you who have been with the podcast for a while, you'll remember this from episode 13. It's a technique I call verbal judo. The principle is simple. You don't meet force with force. You don't block their questions with a hard no or "I can't answer that." That just creates resistance, and it makes them feel dismissed. Instead, you acknowledge their energy, their anxiety, and you gently redirect it toward a safe and productive outcome. You need to have these scripts locked and loaded in your mind, ready to go, so you don't get caught off guard. Here are the 3 you will use most often. Script number 1, the puzzle piece. This is for when they ask you for a direct diagnosis. They point to their throat and say, "Come on, you've seen a million of these. Does it look like strep to you?" You smile calmly and say, "My job is to gather all the puzzle pieces, like your vitals and this swab, so the provider has everything they need to put the full picture together for you. They'll be in shortly to discuss exactly what's going on." This script is brilliant because it doesn't reject them. Instead, it validates your role as essential. You're not saying, "I'm not allowed to tell you." You're saying, "What I am doing right now is a critical part of getting you the right answer." It makes you an active part of the solution and builds their confidence that a thorough process is underway. Script 2, the safety pivot. This is for when they ask you for medication advice. "The doctor prescribed this antibiotic, but can I take Tylenol for my headache?" You look them in the eye and say with genuine care, "That's a really important question. I want to make absolutely sure you get the safest information for your specific medical history. Let me flag the provider to answer that for you before you leave." This is a masterclass in reframing. You turn a moment where you could be perceived as not knowing something into a moment where you are demonstrating the highest level of professional caution. You're not saying, "I don't know." You're saying, "I prioritize your safety too much to guess." It makes them feel protected, not dismissed. You become their safety advocate. And script number 3, the hard stop. This one is for the awkward hallway encounters. A patient or their family member stops you. points to a rash on their arm and says, "Can you just take a quick look at this? What do you think this is?" You have to shut that down immediately, but with compassion. You make eye contact and say, "I can see that's really bothering you, and it deserves a proper look. It's outside my scope to evaluate that here in the hallway. Let's get you checked in and into a room so the provider can give it a proper medical assessment." This script does two things perfectly. It validates their concern by saying, "I can see that's bothering you," so they feel heard. But it also firmly establishes a professional boundary by explaining why you can't look at it. Not because you don't want to, but because a hallway is not the appropriate setting for a medical evaluation. It respects their concern by insisting on a higher standard of care. You don't need to apologize for not being Sherlock Holmes. Your job is to be the best Dr. Watson imaginable. Own your role. The provider cannot do their job safely or effectively if you don't do your job perfectly. Your professionalism is the foundation of it all. And that brings us right into your map moment.
It's time for your map moment. A quick little push to keep you going. Stay focused, keep strong. Your pathway to success is on.
All right, it's time for your map moment. And I want you to come with me to a very specific place. I want you to picture that exam room again. The patient has just asked you about that mole, that symptom, that fear that's been keeping them up at night. Their eyes are locked on yours. And in that silence, you can feel the weight of their hope and their terror. They are searching your face for an answer. And in that moment, the easiest words in the world are about to come out of your mouth. The words you think they want to hear. The words that will break the tension and make the fear go away for just a second. I think it's nothing. I need you to understand something. When you say those words, you might think you are offering comfort. But what the patient might hear is something entirely different. They might hear, "Your concern isn't valid." They might hear, "You're overreacting." Or they might hear, "I'm dismissing you." You offered a guess to soothe an emotion. But what that patient desperately needs is not a guess. They need to know they are being taken seriously. They need to know they are in a place where their concerns are the highest priority. They need to feel safe. So, your map moment this week is not just a challenge. It's a professional vow. From this day forward, you are going to make a conscious choice. You are going to replace the 4 words of false comfort with the 7 words of true advocacy. Let me get the provider to look. I want you to feel the difference in those phrases. One is a dismissal. The other is an escalation of care. One is a guess, while the other is a guarantee of expertise. One is about making you feel helpful, and the other is about making them feel safe. The very next time you are in that situation, I want you to take a deep breath hold that professional line, and deliver those 7 words with calm confidence. And then I want you to watch what happens. Watch the patient's shoulders relax. Watch the fear in their eyes get replaced with a flicker of relief. Not because you told them it was nothing, but because you proved to them that their concern was your top priority. In that moment, you didn't just follow a rule. You built a foundation of trust that no textbook can teach. You single-handedly transformed their experience from one of anxiety to one of safety. That's not just good practice. That's leadership. That's the heart of what we do. We started this episode by dismantling a phrase. Stay in your lane. We talked about how in healthcare, lanes merge. They intersect. We are not driving in parallel lines. We are a convoy, moving together, responsible for the safety of one another. Your real job isn't to stay in a lane. It's to know your role on the team so well that you can perform it flawlessly, while also having the situational awareness to know when another teammate needs support or when the entire mission is at risk. But I want to leave you with a much bigger idea, because for years, in our culture, in movies, in stories, we've been fed a lie about what courage looks like. We've been taught that the hero is the maverick, the one who breaks the rules for the right reasons, the one who steps outside the lines, trusts their gut, and makes the renegade call that saves the day. And I'm here to tell you that in the world of healthcare, that is a dangerous fantasy. That is not heroism. That is ego. So what does real courage look like? What does it look like when the stakes are a human life? It's not the courage to offer diagnosis you aren't qualified to make. It's the courage to look a terrified patient in the eye and say, let me get the provider to look. Knowing that the safest answer is the only answer that matters. It's not the courage to break protocol to help a stressed out provider. It's the courage to hold the line, to be the guardian of the standard, and to protect your entire team from a catastrophic mistake. The most heroic thing you will ever do in your career is not to act like a doctor. It's to be the most disciplined, the most observant, the most unimpeachable medical assistant, tech, nurse, student in the entire building. Because your flawless data collection is the foundation of a life-saving diagnosis. Your integrity is the firewall that protects the entire system. Your power is not in what you think you know. It's in the integrity of what you actually do. Don't ever let anyone tell you that your role is small. The person who gathers the facts perfectly is just as vital as the person who solves the case. Remember, Sherlock would have been lost without Watson. You are not a subordinate. You are a partner and a protector. That is the reality. That is your value. And that is your power. Before I let you go today, I want to try something a little different. We just talked a lot about the friction between protecting your scope of practice and dealing with the toxic workplace culture of people telling you to stay in your lane. I know for a fact that every single person listening to this has a story about being pressured to cross that line. or being shut down when they tried to help. I want to hear those stories. Head over to LinkedIn and search for my name, Frederick Nazario Alvarado. I'm putting up a post specifically for this episode. I want you to connect with me. Go to the comments on that post and tell me about a time you had to hold the line on your scope of practice, or a time you had to deal with the stay in your lane mentality. Let's get this community talking. Let's share the intelligence so the next rookie coming up behind us doesn't have to walk into the minefield blind. Find me on LinkedIn, drop a comment, and let's build this network. Until next time, keep learning, keep growing, and keep following your map, your medical pathway for success.